It is too early to release lockdown. We've done such good work in the last 3 weeks. It would be crazy to throw away the sacrifice that people have already been made and go back to allowing people to go out and spread the virus further.
You must stay whatever it takes. We will beat the coronavirus, and we will beat it together.
So here we are in our 4th week of lockdown as we all try and get our head around these draconian and economically devastating restrictions in place to our way of life. Other countries around the world starting to come out of lockdown slowly but surely, yet we're not able to do that yet in the UK. Dr. Hilary, thank you so much for being here again, explaining coronavirus. Do you agree with the government's position that it is far too early to talk about coming out of lockdown here?
Absolutely, absolutely. Look, we're still seeing a rise in the cases of people going into hospital with respiratory distress, people having awful symptoms and whose lives are threatened. We're still seeing more people lose their lives from COVID-19. We're seeing an NHS which is being overwhelmed by the number of cases coming through, just managing to cope with what's happening, but making tough decisions about who they treat and how they treat them. So it is too early to release lockdown. We've done such good work in the last 3 weeks. It would be crazy to throw away the sacrifice that people have already been made and go back to allowing people to go out and spread the virus further. It would be just too much. So we just need to be a little bit more patient. People have been so good in adhering to the guidelines, which are really good, based on scientific evidence, based on logic, based on fact. It's beginning to work. Let's hang on to the good work that's been done and continue so that we can beat this virus one way or the other in weeks and months to come.
Hilary, lots of conjecture about whether we have reached the peak yet. Do you think we have? And if we haven't, how bad is it going to get?
I don't think we've reached the peak quite yet. For those people who are hoping that the slightly lower mortality figures in the last couple of days mean that we have, I would just say, look, we've had a bank holiday and it's likely that there's going to be a slight time lag in reporting deaths, both in the community and in hospital. So I don't think we're at the peak quite yet. I think we're going to see the peak perhaps in a week's time. 10 days time, and then hopefully we won't see an increase in cases. We'll see a plateau and then a gradual diminution in the numbers of cases. That's our hope, and that will mean that lockdown has worked, and that we can start thinking then, maybe in a month's time, about a de-restriction of some of these regulations that have put us in lockdown.
Although, Dr. Hilary, one of the fears, and it's even one of the fears that the Health Secretary Matt Hancock has, is that people are becoming almost too scared to leave their home. We've almost done too well in some ways during lockdown. And it's particularly important, isn't it, that if you have a health-related issue that isn't connected to coronavirus, you do feel confident enough to leave home and go to hospitals. Hospitals are still treating other urgent conditions, be it strokes or heart attacks or any other emergency condition, because there's a big fear right now that a lot of people aren't getting other health issues seen to, and that could have great consequences down the line.
Yeah, it's a great question. It's really important for people to realise that general practice continues. Routine, important work in hospitals continues, independent of COVID-19. So in hospitals, we've created red zones where people are assessed for COVID-19 if that's a suspicious diagnosis. But there are all other departments still working, people treating people with cancer, for example, people having stents for heart attacks, people having acute treatment for strokes. It's important that people realise that general practice still functions. The doors of the surgery might physically be closed, and GPs might be doing a triage system on the telephone or through Skype, for example, through telemedicine, but you can still talk to your GP about the things which occur on a daily basis. I know that other things are postponed, which can wait. Things like dentistry, routine eye checks, routine dentistry, they can wait. But the emergency things which happen all the time, independent of the pandemic, still continue. It might be more difficult to get your diagnostic scan, it might be more difficult to get your treatment, but it still continues, and you must use the usual channels, GP, 111, to get that help.
Yeah, absolutely. And I think it's important to say that we've been staying home to avoid the NHS being overwhelmed. It doesn't mean that leaving home in itself, if you're a relatively healthy person under 70, is necessarily a scary proposition. Great questions from you coming through on the hashtag Ask Dr Hilary. Stephen Pervsey first up today, and he asks Hilary, how will the government roll out testing for everyone and when?
Okay. So the important thing is that we find out who's got this virus now, whose symptoms are caused by the virus, and that means the first priority are patients coming into hospital with breathing difficulties. And it also then means that we need to check who has got the virus amongst people who work in healthcare on a face-to-face with patients. So that means obviously doctors in intensive care, critical care, A&E, and all other doctors and nurses and any kind of staff, cleaners too, working on the front line with patients. They need to be tested so that we can see whether those healthcare professionals need to take time off and self-isolate, or if they haven't got it, whether they're safe to keep working. That's absolute logical sense. Now, it would be great if we could test everybody else who've got milder symptoms who aren't in hospital so that we can tell whether they need to self-isolate or not, or whether they can continue to keep working, whether they need to keep away from other people. However, it's difficult you can't test the whole population. You've only got so many tests available, and the ones we have are prioritised for the most important people. And when we get more capacity, we will be able to test everybody else, people in a public facing role, people working in checkout, people working in deliveries, people working in public transport. So paramedics, I mean, it's crazy that they haven't had enough testing, and I know that in some areas paramedics, have large numbers of paramedics have tested positive in some trusts, maybe 50% of them. So we need more testing. We hope to have 100,000 tests a day by the end of the month. That's a difficult ask because it's just a question of getting enough swabs and reagents. But we're getting there. And whilst everybody likes to criticise the government, I think they are doing their utmost to get as many tests as they possibly can and make them reliable. Down the line, we hope to get a reliable antibody test that will look back and see whether people have had the virus or not, and whether they're safe to see other people and go back to work. And again, that will take time.
We certainly had a slow start on testing. I don't think many people could disagree with that. Fascinating question here from Phil, Dr. Hilary. This is almost a moral issue, to be honest. He says, a neighbour on our terrace keeps getting visits from her family and her new boyfriend. How do I report her? Vulnerable people live in the terrace and share a path with her.
Yeah, some people just don't get it, do they, Dan? There is a reason why we have these guidelines. You're not meant to have visitors. You're not meant to have visits from friends or family. Social distancing means exactly that. Staying at home means exactly that. And the more people that flout the guidelines, the more the virus will transmit. I think it would be reasonable to just say to people, have a look at the guidelines. You're not adhering to the guidelines. You're putting people at risk, as politely as you possibly can. Who are you going to report them to? I suppose the risk that they're taking is largely theirs and the people who visit them, but that has a knock-on effect down the line to other people who completely innocently could be exposed to the virus, and there could even be a death down the line that they can't see. So they are being selfish. Some people are direct and will tell them that and say, you're being selfish, stop it. Other people are a bit more sort of laid back and might politely point out the error of their ways. But if everybody followed the guidelines, we'd actually, to be honest, most people are, thankfully, we would be better off than people who don't understand and flout them.
Well, it is interesting, some people using social media. The high-profile writer Caitlin Moran was actually exposed by one of her neighbours for going to parties over the weekend. So if you're high profile, you've been put on notice that you need to follow these rules, Dr. Hilary.
Well, whoever you are, and there have been people exposed. I think the health minister in New Zealand was embarrassed. The Scottish medical officer, chief medical officer, was exposed not practicing, what they were preaching. And it's unforgivable, really, because there are no exceptions. There can't be an exception. Whoever you are, unless you follow the guidelines, you are putting other people at risk. It's selfish. It's stupid. And I would just say to people, please think again. Have some imagination. What you do, what you decide to do, impinges on other people that you might never see, but you could kill.
Exactly. Listen to that advice, Caitlin Moran, I would say. Next question from Michelle Tipper. She says, I'm a community carer going into people's houses. I have been given a visor, which is great, but I have to wipe it with antibacterial wipes after every visit. I am running low on antibacterial wipes and am unable to find any in the shops. What else can I use?
Well, probably the word antibacterial is a misnomer, really, because the virus doesn't respond to antibacterial materials nor to antibiotics. So you really want something with at least 60% alcohol. And isopropyl rubbing alcohol is probably the best thing to use. And you don't even need to put moisturizer in that because it's not going on your hands. So anything with more than 60% rubbing alcohol would clean your visor and eradicate any virus. Failing that, you could use soap and water because the detergent in soap actually helps to destroy the fatty layer on the outside of the virus, just as you do with soap on your hands. It would protect, it would kill off any virus on the visor. So that would be the second best thing after rubbing alcohol.
Let's go to a video question now from Helen Catino.
Hi, Dr. Hilary. My question is, can you catch the coronavirus from supermarket trolleys? Not all of them seem to be washing them as you go in, and I'm really worried because I'm doing shopping for my father-in-law who has severe COPD.
What's COPD, Hills?
Chronic obstructive pulmonary disease.
Got it. Okay.
So things like chronic bronchitis, emphysema, that sort of thing.
Okay, so Helen's very worried about supermarket trolleys. I have to say, in the supermarket I was in over the weekend, they did have a great system in place where I returned the trolley and there was a staff member who sprayed it and wiped it down. But maybe that's not happening in all supermarkets, Hilary.
No, I doubt if it is, and I doubt if the baskets are cleaned thoroughly every time either. So anything you touch could potentially be contaminated by the virus that somebody else has transmitted there. So this is the thing about hand washing. If you frequently hand wash, whether you've touched a basket in the supermarket or the trolley, if you're using hand sanitizer and you're frequently washing your hands, you're minimizing your risk. Hopefully, responsible supermarkets and outlets are washing down the shelves and the baskets and the trolleys, but do it yourself, and then your risk is minimised.
Mark Fox, and this is one I've been interested in. Can food and its wrapping be put in the freezer to kill the virus?
Yeah, the freezer would almost certainly kill off the virus. The virus is not very strong. It's just a strand of protein with a fatty layer on the outside of it. And both hot temperatures and very cold temperatures will kill it off. But with packaging, just to be on the safe side, remove the packaging, throw it away, wash your hands afterwards. And
finally today from Umit Kavlak, who asks, can we still go on our summer holiday this year?
I very much doubt it. That's not what you want to hear, is it?
It's not what I want to hear, that's for sure, Hilary.
Trying to be realistic. But no, I mean, look, we're going to be seeing a peak of cases in the next couple of weeks. Then it's going to plateau and there's going to be a gradual decline. But it's going to take a long time for airlines to get back and running, a long time for holiday destinations to open up again. I think realistically, you need to put any plans for your summer holiday on hold. I don't think holidays are really going to start again until, well, this is my guess, earliest late autumn, winter, spring next year.
What sad news. Very, very sad news. It shows how truly life-changing this is.
Yeah, it probably doesn't mean that you can have you can probably have a holiday in the UK later in the year, but I think that's probably the best we can hope for at the moment, realistically.
Dr. Hilary is back on Monday. We've been getting thousands of questions. Do keep them coming because we've got lots more which we can go through next week. Just head to thesun.co.uk/Dr. Hilary, head to talkradio.co.uk or use the hashtag Ask Dr. Hilary. Post your video question on any social media site And Dr. Hilary will be back on the Sun's YouTube channel from Monday, and also My Talk Radio Drive Time show between 4 and 7. Dr. Hilary, have an amazing weekend. Thank you for all your work this week. And of course, your column will continue to run every day in the Sun as well.
Thanks, Dan. You take care.